the recording. Good. We'll start recording today's Zoom lesson, and I will do a share screen. And there we go. And that way we can talk about the notes for subtopic 4. We're moving through the course. It's really interesting. We're not that far from being in the mid semester point because spring break is the 9th through the 13th. So, and that's midpoint in the course. So, we look up and we've come a lot further through the course than we think we have. Today, I wanted to talk a little bit about ethical issues and health care and health choices. And there's some shallow topics in some of this. Some of this got some deep stuff in it. I was looking at some of these decisions, but we make decisions about our health choices, and those affect the behaviors that we do, the behaviors that the provider does. We have different treatments, different lifestyles, and all of those things affect our physical, mental, and social well-being. Some of the examples are seeking and are refusing medical treatment. The other day, my wife was telling me about one of her cousins whose sister died with cancer, and now she's been diagnosed with cancer. And she saw all the things that her sister went through. She went through chemo, she went through radiation, she did the treatments and all that, and she died anyway. Well, there is no treatment that's 100% effective. If they had 100% effective treatment for cancer, that we wouldn't be able to afford it, I promise you, because they'd be selling that for trillions of dollars. Jesus said, "What will a man give in exchange for his soul?" Well, of course, in exchange for his life, he would give anything that he has or the life of his family. But her cousin, watching her sister die with cancer and taking all that treatment, now has been diagnosed with a similar cancer, and she goes to the doctor and they tell her we need to do chemo, we're going to do radiation, you're going to do this and you're going to do that, and she looks at them and said, "No, I'm not." What do you do? I mean, the individual has the autonomy to make the decision of what they're going to do with treatment. And it is a very personal health choices are very hard to make. They're very, who knows what we will have to face. I had a good friend. He worked hard all his life. He had bought land and he built a ranch, and he saved and he generated. They had a nice house, and they didn't have massive amounts of money by any means, but they had adequate money. He and his wife, and he goes to the doctor and they diagnosed him with terminal. I think stage 3. It wasn't stage 4, but stage 3 cancer. He went home and put a rifle under his head and blew his brains out. He and left a note. His deal is they're not going to take everything I have and doing treatments on me and me have to go through that. He just chose to end his life. I certainly don't advise anybody to do that. I have lived through the effects of suicide. When I was, I guess, about 23, my sister Kathy took 22. My sister Kathy took her life, and I understand the people that are left behind. It was horrible, but he was thinking about what he had, and he refused the treatments. And instead of even considering any of that and losing all the stuff he had, he wanted to leave it to his family, so he just ended his life. That's a terrible thing. Uh, people make decisions about whether they're going to have treatments or not. And part of it is a healthcare provider. Imagine if you knew that, say, the cousin whose sister died, that her cancer's not the same. Maybe she would be more likely to survive that than what her sister had, but she's refusing treatment. How do you convince them to have treatment? how do you share those things with them? You can't. I mean, they have to make the decision. Are they going to take their medicine? I have my little box. I set it down. It's got morning and night, and so he has his little box that has morning and night. And every morning I get up and I give Zoe his little medicine, and I take my medicine. Zoe, as an autistic child, he has more behavior modification than anything else. I mean, he is the medicine he takes calms him down. I tried to take him off of it gradually. The doctor thought, well, we would try, and he got violent. I mean, he's strong as an ox. I'm an old man. He gets violent with me, and I got my bluff in on him. Yeah, he may take me out, but I'm going to take him out when I go, type thing. But medication use is another deal. What if an individual not only refuses treatment, but then another individual goes to the doctor and the doctor says, you need to take this specific medicine, and they refuse to take it? Well, you can't do anything. I mean, it's their choice. Some of the examples of choices we make, are we going to accept preventative care? Are we going to do diet? Diet is a big deal in lifestyle decisions. My wife told me last night, she said, Rusty, your blood sugar and your cholesterol are down. And my blood sugar, this time the doctor celebrated. I mean, I went like from an 8.7 down to a 7, I mean, within bounds, like a 7.9. Well, the thing is, I've been taking my medications. I've been following the directions that he gave me. I love Bluebell ice cream, and I'm a diabetic. Man, I love those little ice cream bars. You stick them in the freezer and you sneak in and get one, when your wife's not looking. But what I've been doing is kind of compromising. I've been eating fruit. Uh, Natural sugar is not nearly as bad for you as processed sugar. Now, I'm not saying it's good for me to eat a thing of grapes at night, but I would rather eat a thing of grapes than eat a big bowl of Bluebell ice cream. And my blood sugar has come down. And as my blood sugar comes down, it has impact on the rest of my health, my ability to heal. I have 7 heart stents, and all those type things going on. But when we look at decisions, some of the examples are am I going to seek help, or am I going to refuse the medical condition? Am I going to take the medicine that they recommend for me? Now, I tend to, they recommend the medicine to me, and I don't, some of it I can't take. Those blood pressure medicines that cause horrible cramps, I can't do that. And I tell him, no, I can't take that. I've had those diuretics. But anyway, eventually they'll listen to you if you keep, showing good faith and trying to do things. Lifestyle decisions. I was thinking the other day about going up on Jabal Jais Mountain north of Ras Al Khaimah. We went up to the top of that. They have the world's longest zip line. And I may be one of the older people that ever rode the zip line. I got on that world's longest zip line. I rode all the way to the bottom. Well, is that good for me or bad for me? I was looking yesterday at some folks, that husband and wife that live close to us, and they get out in the morning and they walk. And they walk in the afternoon, and I ride past and wave at them. Maybe if I change some of my exercise routines, I might be doing better. But we make those choices. Are we gonna maintain a decent diet based upon the illness that we have? And basically, it is, are we going to listen to our medical providers? My daughter gets very angry at me sometimes. She says, "What are you doing, Daddy?" My daughter is a nurse practitioner. She's finishing her doctorate in nursing. Call me, "What are you doing, Daddy?" "Well, I was sitting here eating, a honey bun." You put that up right now. You don't need bread. You need to stay off bread. Bread turns to sugar. Well, you're trying to follow the rules, and some of the rules can be, they can overburden you with rules. You need to have some common sense. Sometimes you might seek a second opinion. My father-in-law, he worked maintenance and was the head maintenance man at Tyson processing plant. He worked hard. The doctor said you can only have 1,200 calories a day. 1,200 calories a day might work for me when I'm sitting at a desk, but it didn't work for him. And they put the rules on him so tight, and Sylvia, my mother-in-law, enforced them so harshly that he learned to sneak around. I was with him one day. He pulled in this little place called Handy Andy's, went in and bought him a greasy hamburger. He was hungry. Well, if with communication with a doctor, you might say, well, 1,200 calories is good for Rusty who's working at his desk, but I work maintenance and I've got to have more. I burn off more than that. You can reach a compromise rather than just going hog wild. So when you make these choices, there are a lot of ethical decisions that fall into these things. What is right and what is wrong? Oh, yeah, the doctor tells me not to eat ice cream. I love ice cream. I dream about ice cream. There's nothing I love more than taking Bluebell ice cream and pouring a Coke on top of it, or pouring chocolate syrup. I like a Coke float. Yesterday I drove past Whataburger and almost had a nervous breakdown because I wanted a vanilla malt. Well, is it right or wrong? Well, some things are not necessarily right or wrong. And I know my wife would argue with this, but some things are in the middle. My situation for me eating ice cream is wrong because it definitely impacts my blood sugar, and the blood sugar being high impacts my health substantially. And I have to control it. But my father in law, when he was alive, he might still be alive if his diet had been a little bit more generous. He went from 1,200 calories to stopping at Handy Andy's 2 times a day and getting him a greasy hamburger and eating that. And he was sneaking around doing it. And it put him in a place where he couldn't be successful. What is fair? With him, I didn't think it was fair that he couldn't eat. I felt sorry for him. And no, you got 1,198 calories. You're not having anything else. Well, you can eat lettuce. You can eat. He really needed more than 1,200 calories. He probably needed at least 2,200 calories for the amount of physical work that he was doing. But is it fair? And who is affected by the decisions? Oh, my wife gets all upset at me. Her father died at 56 with heart issues. I'm 69. My daddy died at 78. My grandfather died at 78. My daddy's two brothers each died at 78. And I'm 69, and Sharon's worried. Sharon's worried about what I'm eating. She's worried about exercise. She gets involved with that because if I die, then I leave her behind. And my decisions don't just affect me, and her decisions don't just affect her. Her cousin that's refusing health care for her cancer has children. Now, granted, they're children in their 16s and maybe to 20, but they need their mother. And if you're refusing, well, my sister, I'm not going to go through what so and so did. She did all that and she died anyway. Well, actually, we're all going to die anyway. But it's a matter of time when we're going to die. The Bible says it's appointed unto man once to die, and after this, the judgment. Somebody asked the guy, "Are you ready to go home?" He said, "Yeah, I'm ready to go home." He said, "But I'm not getting on the bus right now." Okay. Our decisions impact us, and our decisions impact all those around us. That has to do with health decisions. Come on in, Leslie, and join us. That has to do with health decisions and has to do with other decisions that we make. A lot of times, people don't understand how impactful their decision for education is. Juliana, how many are you? How many in your family have an education?
It's just me and my sister.
Yes.
My two siblings, they don't have it.
But
My
but
degree is me and my sister.
but you and your sister are setting a pathway. Leslie, who in your family has an education?
Yes. But don't.
Yes. Yeah, but you see your decision for education will impact more than just you. Years ago, I decided that I was going to go to college. Now, my mother had a bachelor's degree, later got a master's degree. My father almost finished his bachelor's degree, but then he got in trouble because he hit a math teacher and knocked daddy was mean, you know. But Sharon's mom and daddy, neither one of them, they're good people, but neither one of them had an education. Few in Sharon's family had an education, and I decided I would go back and go to college. And you know, when you go to college, you sacrifice. I was a young married father. You know, we had Amanda, and I'm trying to go to school, and we're struggling, but my mother-in-law one time told me, said, you need to go down to the chicken plant and get you a job. I said, no, Sylvia, I need to finish my bachelor's degree and get a job. And I finished my bachelor's degree and started teaching school. I made a huge salary back then. I made $11,000, $111.11 a year. That was after I got my bachelor's degree teaching. Salaries have gone up substantially since then. But my decision to go to school impacted my whole family. Sharon went back to school. She got her doctorate degree. Sharon's sister went to school and is an LVN and has a bachelor's degree. My daughter is working on her doctorate degree in nursing. My son has a master's degree. My other son is finishing his doctorate degree out in California. Now, Zoe's just where it is. I want a Diet Coke shirt hanging out, but your decisions impact others than you. Think about your health decisions. What if I refused to address the diabetes that I have? I have type 2. I could die from that. Matter of fact, probably some of my heart issues stem from having had diabetes. And if a person goes and they refuse the care that they're given, we can't make them do it. But we can express to them that their decision affects lots of people. When Sharon's daddy died at 56, when I got 56, I had my first heart stent. Sharon was livid. Her daddy had a heart attack at 56, and now her husband is in having a heart stent. And it didn't help that I was playing gospel music, you know, just to calm me down as I got ready for the surgery. And she thinks, Rusty's expecting to die. Well, it wasn't my time by any means, but I do like gospel music. So you know, when we start thinking ethical questions about care, about decisions that people make, to me, it is somewhat unethical to go to a doctor and refuse the treatment because my decision is going to impact lots of people. I mean, you need to be careful before you refuse that. And just because somebody else had it and didn't do well, we don't know. Now, guys, I've done a lot of counseling in my life. I pastored many years since I was 18, and I've talked to a lot of people that were struggling with illness and doing different things. And you know, you have to get them to stop and think about the impact of decisions.
I like the way that you're saying that
Yeah.
our decisions impact the others that are around us.
Well, my grandchildren want to go to college. Some of them are already going. Some of them did good, some of them didn't. Okay. Some of them are growing up, thank God, you know, because they go and they first time they got a little freedom and all of that, and they you know it's okay. They flake out, but then they have to grow up. But our decisions affect everybody. Oh, I was thinking the other night, you know, I've been real good about not eating ice cream. I was telling you, I love ice cream. I used to love going to the store and I'd buy those boxes of ice cream sandwiches so I could eat three or four of them at a time, stick them in the freezer, hide them so Sharon didn't know they were there. But when I jeopardize my life, it impacts my mate. It impacts my kids. I get Zoe up every day. And I take him and I undress him and I put his clothes in the washer dryer thing at our RV and I take him in and I shave him, clean him up. He likes looking good. I then take him in and I give him a shower and I scrub him down. I mean, he's clean every day. He's clean. Get him out, dry him off, brush his teeth, comb his hair, spray him with cologne, and he's got a place on his hip where he has a skin, what are they? A skin rash. I went blank. But I put a cream on that, and then I go in and get him dressed. Well, what happens if I eat myself into the grave? Who's going to take care of Zoe? Now Sharon can dress him up, but Sharon tells me I don't shave him as good as you do. I've been shaving. He's about to be 38 years old this summer. I've been shaving him for years, at least 26 years, and he's got that tough Hungarian beard. I can shave him without cutting his ears off, and get him dressed. And he's got Sharon laughed the other day, said, "You've got him." She said it's kind of like watching that old cartoon Meet George Jetson when they'd get on the conveyor belt. I said, "Yeah, I put him on the conveyor belt. We run him through. When I get out, he's ready to go." He goes in and puts his shoes on. But our decisions and our health decisions impact other people. And, as healthcare providers and healthcare administrators, we need to be able to convey to people what their decisions may influence. A young mother refused cancer treatment because her sister died with cancer and she just gives up. Well, that's fine, but what about if you have children and you leave those children behind? I hope, we don't know when we're going to die. We don't know which one of us will have the next disease that'll carry us home. We may walk out there and a rock fall out of heaven and crush us. We don't know. It's not likely that that's going to happen, but we need to live in such a way that we understand that our lives impact other people and those other people are important. Some of the core principles that really stand out. One of those is autonomy. Autonomy means you have the right to make informed decisions about your own health. Now, as an adult, you have that right. A child does not have that right. I know they've had many lawsuits where, say, a parent's religious belief says they can't have a blood transfusion. And there are some, I've got friends that believe, oh, if you have a blood transfusion, you're damned. I personally believe that if you reject the Lord Jesus Christ, you're lost. And if you find the Lord Jesus Christ, they can transplant all your blood if they want to. You still belong to Jesus. But kid gets sick and the kid needs a blood transfusion and they won't let them have it. And there have been many cases where the doctors and the hospital went to court to ask a judge to intervene for the child. Maybe they didn't want the child to have a certain type of treatment that the child needed. I'm a parent, and one of my kids gets sick, I want the treatment. If one of my grandchildren gets ill, treat them. We're going to listen to the doctors. But not all parents operate that way. And where are the ethics of that? If I choose myself as an adult to reject the treatment, that's one thing. But if I choose for my child, make the decision for them that we're going to reject the treatment, that's altogether a gray area. And does that constitute child abuse? Well, it could. Does it constitute child endangerment, which is a crime? It could. And the courts, can you imagine being the judge and you have to hear the case? Now, if I hear the case, the child's going to get the treatment, but I'm not the judge. So you have to be, one of the things it says here, fully informed and capable of deciding. I want you to think about Zoe just a minute. Zoe's a sweet child. Zoe came from Romania when he was 2 years and 10 months. He was so malnourished. He was like a infant. He had not cut any of his teeth because at 2 years and 10 months he hadn't had any nourishment. And when he did cut his teeth, he had no enamel on them. That's how malnourished he was. Zoe had a big lacking of a dividing thing between the upper chambers of his heart. He would just, you move and he'd just sweat. Well, that's like you do with heart issues. And we had to give him Child's Nitro. He was 6 years old before he got strong enough to have heart surgery where they would agree to do it. So we had to make the decision that he would have heart surgery. It's a hard decision for parents. We knew that he was going to die if he didn't have it, but we knew that there was a lot of chance that he would die when he did have it. Matter of fact, there was a little girl that had surgery at the same time he did, and every time they closed her heart, she would die. So they kept her, and she finally died anyway. She was beside Zoe. Zoe, Zoe thrived. His heart surgery, he started eating. He wouldn't even eat. He was 6 years old. It was after he had his heart surgery that he started eating. All he would do is drink one type of formula called Pediasure and go check the prices of that. Mega expensive. But now he hates doctors. Had open heart surgery. He doesn't mind taking me to the doctor. If I'm going, he knows, oh, he don't care if they give me a shot or anything, it's okay with him. But when he's going to get a shot, he puts up a fit. But he is not capable of deciding whether he needs care or not. So I have to make the decisions for him. I'm his I guess they say in Medicare and Social Security, I'm the legal authority. Yes, and I have medical power of attorney, and I have durable power of attorney for him. But he's not capable. But if we're going to make a decision, we need to see that the patient is fully informed and capable. Go back to the young mother that refused care for cancer because her sister died with cancer. The first issue is she fully informed? The next issue is she really capable of making that? Well, she's a normal, average person, I assume, and they did everything in the world to let her know this is not necessarily exactly like the cancer your sister died with. She believes that it is. She's decided that it is, and she's decided that she's not going to make it. But our issue is to make sure that they're fully informed, come on in, and capable of making the decisions. They have to be informed, and that's autonomous. They have the right to make the decision. Beneficence means acting to promote well-being. Is it in my am I going to act to promote my well-being, or am I going to promote the well-being of my children? It applies to individuals and healthcare providers. Um, I had a friend when I was a lot younger, and he got pneumonia. And there are different types of pneumonia. There's pneumonia that takes you out slowly, and there's pneumonia that'll take you out quickly. Well, I mean, he went to the hospital and they told him he had to pay them $500 or they wouldn't accept him. He didn't have $500. He called his daddy. Dad, no, I'm not giving you $500. I can't. Now listen, I can't imagine that. My son's at the hospital and he needs treatment. I'm going to come up. I'll steal it from his mama. I mean, I'll find it some way. He left that hospital and center and went to Nacogdoches because Nacogdoches had a county hospital that had to treat him. He died en route. It took him out quick. The hospital that refused to treat him had a legal authority to stabilize him, and they didn't. So what happened? Family sued him, and they settled with the family because they had a responsibility to stabilize that person. Health providers have responsibility too. Individuals, we have responsibility. If we're beginning to have some sort of issue, we should tell somebody. I wonder how many people have not felt well, and something going on. They just wouldn't discuss it and sat down in their recliner, and their wife found them dead. Okay, because they crossed over. Oh, act to promote well-being, not just our well-being, but the well-being of those around us. Zoe has had an ear infection, and I took him. I mean, it was draining. I called him. I said, "Listen, guys, y'all got to do something. This baby's got an ear infection. I need an appointment." They said, "Well, how far away are you?" I said, "I'm about 15 minutes from you." They said, "Can you bring him right now? We have an opening." I said, "I'm on the way." Well, they got there and they treated him. Have you ever had an earache?
Mhm.
What if you had an earache and you were autistic and legally blind and can't talk? How do you communicate that? Somebody's got to look after him and take care of him. We do that with our children. We have a responsibility, even as people, to one another. Sharon's dad got salmonella. He worked in a chicken plant, processing plant, and salmonella is a disease that is carried by chickens, but it's a deadly disease. He was laying in there in the bed and wouldn't get up, wouldn't listen to anybody. I went up there, I said, "You get out of that bed and you get in this car. We're going to the hospital." He said, "Oh, no." I said, "You either get out of the bed or I'm going to drag you out of the bed." And he went and found out he would have died if he stayed there. So, our purpose is to act to promote well being and to prevent illness or injury as much as we can. You see insurance now doing things to screen people more. Next Friday, I have a doctor's appointment. The insurance called me up and said, "We need you to go X, Y, and Z. You got to go." I said, "I don't want to go." They said, "You need this screening, and we're gonna take you there, and they're gonna screen you." And then because next day I was reading in Yahoo, where I get my news, I was reading about how colon cancer has increased radically in our day and age. And that's what they wanted to do. They want to do the screening to make sure I don't, but they're using preventative medicine. So some of those things, non-malfeasance is means to avoid causing harm. My friend that died with pneumonia, the hospital had a responsibility to stabilize him. They couldn't just say, "No, we're not going to treat you unless you got $500." They had a responsibility, even if he didn't have the money, to stabilize him as a healthcare provider. And later on, it took the family sued about 2.5 years later. It comes up to the court docket, and they know they're going to lose. They held it out as long as they could, and they settled with him and gave him a large settlement. But his life was worth more than the settlement. If they had taken him in the hospital, ultimately it would have cost them much less. Maybe they would have been able to save his life. Probably not, because some of those diseases are very, very fast acting. Just because you have pneumonia, I get the old people pneumonia. I go take my pneumonia shot. Medication relieves symptoms but causes severe side effects, and you have to weigh the risk versus the benefits. In our society, one of the things that doctors faced, one doctor gives a medication, another doctor gives a medication, another doctor gives them, and they're taking all three of them, and when they blend together, they're deadly. All three doctors have legal liability if that were to happen. Um, Sometimes you can take medicine. They have to, and You have to know when they give you medicine. They tell you now, I go get my medicine, they got a piece of paper hanging on it. Talks about all the side effects. Your blood sugar is going to be better, but both ears are going to fall off. So you have to but at least you're informed as a consumer. You see much more of that. And nowadays they not only, you have big online pharmacies. You have big online pharmacies that mail me my medications. They run those medications to see if there's cross effects because one medicine might interact with another medicine, and they test, and I feel better about that. Somebody I don't know, and they always ask me what are you taking? Well, I'm taking a little pill that's this long, little pills like that, and one that's flat and round. That's all I know. I generally don't know the names, but those are things to weigh. And what are the benefits versus the risk? If you take blood thinner, I've taken blood thinner for years. But one of my old deacons for when I pastored in Gordonville, good old man, but they gave him blood thinner and his blood started breaking down and he bled to death internally. Once it started doing that, they couldn't stop it. You never know how something is going to react. And when we take medication, there is no medication that doesn't have a side effect. I don't care what they tell you. My sister-in-law, Sharon's sister, took she was taking medications and it had Tylenol and she overdosed on Tylenol and it almost killed her. Just Tylenol could have deadly side effects. So, it's up to us to see that side effects are discussed with patients. They understand the risk, and you see that nowadays with medicine. You go to the pharmacy, you get something filled, and they're going to discuss it with you. Or they're going to give you something that shows what the health. Because if you take that medicine and the side effect kills you, and your family sues them, they want to cover themselves against legal liability. If they informed you, they have much less legal liability than if they didn't inform you. Some of the justice things, definition, fairness, and equitable access to health insurance. It is a dilemma in the U.S. system that it is a money-based system. If you have money, you're going to be good. If you don't have money, you don't have insurance, you may be up the creek. Right now, there's SNAP where they insure young children. They insure old people with Medicare. I got Medicare. Zoe has Medicaid because he's considered to be on his own. He has no income other than what he can mooch off of me, and they send him SSI payments every month. But what about a young couple with kids? And you go to work and your work doesn't have any health care. It's scary. And you get something. My Sharon's niece, another niece, got laid off. And a month after she was laid off, just after her insurance ended, she found she had breast cancer. They had to go through and purchase Obamacare insurance that would cover her. They were able to get help from Social Security, Medicare because she had paid in for a long time, but she's a young woman. Uh, so fairness and equitable, the fairness and equitability of healthcare. I don't know that equitability is there. Oh, I hate to say this, but I went in the hospital. I'm white, male. They assume when I went in, he's a white male. He's at work. He's got insurance. But what if I had been a young Hispanic male? Would they have treated me as quickly? They probably would have triaged me a lot longer. And if we said the system is fair, some do try to be fair. Some discriminate subtly, but our responsibility and justice is that it's fair and equitable system. Some of the ethical concerns when people lack health care access, nutritious food. Do you know it bothers me that kids go to bed hungry. What a tragedy that is. Oh, they were when first year I taught school, there was a kid that was special needs and he was in my classroom and he got in trouble and they were going to suspend him. Now he got listen, if some of those other kids got in trouble, they knew what they were doing. This little kid, he didn't know what he did. I mean, he was just a little kid, and back then they'd just kick him out of school. And I argued about them suspending him because I was in the meeting because the only meal he got in a day was at school. And a little fella would tell me and just tear my heart out. He'd say, he never said Mr. Waller. He always called me Wally. Mr. Wally, I'm hungry. I made sure, I mean, I started bringing stuff to school. I didn't want him to be hungry. But you know, there are kids that go to bed hungry in this country, kids that go to bed hungry across this world. And that's a great tragedy. Um, I know I'm probably a little more liberal than you think I am, but my heart bleeds when I see kids like that. And I know that in safe housing, health education, uh, just to be taught how grateful I am that my kids had a house to live in. They had food to eat. My daughter was fussing about me years ago because, you know, sometimes teenage daughters grow up. My daughter was rebellious and pushing against the rules and all that, and she joined the Air Force. And in the process, she goes to the Air Force counselor. And the Air Force, and she's fussing about daddy, daddy this, daddy that. And the counselor said, well, tell me about your daddy. She told him about you. He said, is your daddy a drug dealer? No. Is your daddy an alcoholic? No, my daddy doesn't drink. Does your daddy, and she went out all this list of things, and Amanda said, well, no, daddy doesn't do that. And the woman looked at her and said, well, I fail to understand what you're griping about. Sounds to me like you grew up in a good home where they cared about you and they took care of you. Where did your clothes come from? Where did your food come from? Amanda always, it didn't matter what you did, she wanted more things. But there are ethical concerns with health care. Is it available to people? And we talk about systemic barriers. Systemic barriers to health care refers to things that the system generates. Some of the things where ethical issues commonly arise, reproductive health. When I think about reproductive health, I think about both sides of it. Um, Suppose I'm pregnant and I didn't want to be pregnant. Do we believe in abortion? What if I can't get pregnant and I can get artificial uh, drugs to help me get pregnant? You know, and listen, there are women that have done that and they have 5 babies. They have quintuplets, okay? Because it's a but look at the ethics involved in all of that. Um, my my sister-in-law is a sweet. Suzette's a very sweet girl, but one of the biggest fights I ever had with Sharon's mother is I pastored the church that they went to, and Suzette got pregnant. And Suzette was not married. And Sylvia said, she's going to apologize to the church. I said, not as long as I'm pastor here. We're not going to embarrass her. She is not the first. She will not be the last. And where's the guy, too? You know, that was one of my questions. He going to come apologize, you know, blame the. And, you know, our society tends to blame women. What about the men? And anyway, I refused that. And well, she may have an abortion. And I told Suzette, I said, you know, Suzette, you're going to have to live with this the rest of your life. Having a child out of wedlock is one thing. So what? I said, you're not the first and last. I wouldn't have an abortion just to hide it. And listen, my sister had an abortion and she's lived with that. I don't, my aunt told her one day, oh, there's a baby in heaven because that's not, no, I would never tell anybody something like that. But look at all the ethical issues that go with that. You make a decision that affects a life. Oh, people want children. Oh, adopt, and I think that's kind of in reproductive health too. You adopt a child because you want a child. I know a family that adopted a child, and the mother had obviously been on drugs. You know what a drug baby is? You know what I'm talking about? A child who, for the rest of their life, will be affected emotionally and physically because their mother or father was using drugs. And oh, it's a terrible thing. But though, what if a person is pregnant and they're taking drugs? What if they're pregnant and drinking? You know, alcohol. What if they're pregnant and just smoke cigarettes? Believe it or not, even that affects the child. And I've seen the father sitting over there holding a beer. Oh, you don't need to be doing it. Well, why has he got one? You know, my wife laughs. She says that there may not be many things that I did right in our marriage. But she said when she was pregnant, I treated her like a princess, and I did. Never, never would I have ever said, you're fat. No, she's pregnant. I'd tell her, you're cute as a bug's ear, you know? But look at all of the ethical things that can take place. A mother that may choose to smoke and it affects the child, may take drugs, may use alcohol. All of those things affect the child, sometimes visibly, sometimes profoundly, sometimes minimally. We don't know what's going to take place. Zoe was probably normal when he was born, except his head was probably large and his mother was 14, and they drilled two holes in the back of his head. You can see the scars, and that affected him forever. Reproductive health is a big ethical issue, and end of life care. My great grandmother laid in the nursing home for 8 years and didn't even know who she was. Now, my grandmother would pray, Lord, when it gets time for me to go, don't let me a burden to my family. Just take me home. And she was at her sewing machine, had been sewing when she fell over dead with a heart attack. I don't want to be a burden to my family. But what if I had a stroke? I can have a stroke. I mean, anybody can have a stroke and be crippled and unable to care for myself. Uh, some countries allow euthanasia, which is the ending of the life for the old. There are those that accuse the U.S. government of using COVID for that deal. I don't know. I don't know. But those are ethical decisions. To pass over, a lot of times as people are dying and they're old, they give them morphine and they'll say to ease their suffering. Every dose of morphine you take takes off your lifespan. Are they helping them cross over with medicine? I don't know. That's hard to decide. But that's interesting. What about taking vaccines? Now, when I was a kid, I went to school one day. They didn't say anything to my mom and daddy. They didn't ask me. They said, get in line. I got a polio vaccine. I still have the scar up here on my arm, right up there. Still have the scar. They didn't, everybody was vaccinated back then. Do you know that they're having measles outbreaks, wild measles outbreak in North and South Carolina right now because so many parents did not vaccinate their children for measles? I was vaccinated for polio. I was vaccinated for measles. I've had my tetanus shots. You listen, most dogs hadn't had as many shots as I've had, you know. They but some parents are opposed to vaccinations. Uh, I know parents that believe it is their God given right to refuse it. But that's an ethical issue. If their kid gets measles, they expose my kid to measles, and hopefully mine has had the vaccine, but that doesn't mean they won't get it. I had the flu vaccine this year. I had the pneumonia vaccine. I had the COVID vaccine. Like I said, most dogs don't get as many shots as they stick me with. One of my friends told me, "Oh, said you're so lucky to get the pneumonia shot." I said, "What do you mean?" He said, "When you get 75 and over, they won't give it to you." I said, "Well, they hadn't had any problem giving it to me." He said, "Yeah, but you're just 69. You're still a young guy." Doesn't thank you. But vaccination decisions are ethical things. Um, Substance use, mental health treatment. Some cultures believe that if your kid has a mental health issue, that it reflects on the whole family. When I was a little kid growing up in El Paso, we had a family of Germans that lived next door to us, and they had a little son that was mentally retarded. He was Down syndrome, and they were ashamed of him because he was Down syndrome. And he used to come out to the fence, and I would talk to him through the fence and give him stuff, and we'd play. Yeah, he was Down syndrome, but he's a kid. I was a kid. So one day they gave us a bunch of tickets to the circus. And listen, this is back in the day when you didn't go anywhere. To get to go to the circus was a big thing. We had a black and white TV. I wasn't even color TV back then. And I went next door and I knocked on the door. Mama told me, I said, "I'm going to go ask if he can go to the circus." "Oh, they're not going to let him go." And if the daddy would have answered, they'd have run me off. If the grandfather would have answered, they'd run me off. If the mother would have answered, they'd have run me off. "God was with me," grandma answered.
Oh.
And the old grandmother, bless her heart, I told her, I said, "I love him. He's my friend, and I'm going to invite him to go to the circus with us." And she asked all the details, and I told her, I said, "We're going to go on this day. We have free tickets." And he went to the circus with us. But they were ashamed of him because he had mental problems. He was mentally delayed. Uh, Guy, I went in the restaurant one time. This is a true story, guys. You don't think things like this happen. I have Zoe. Zoe's with me. And a guy looks at me. He was obviously a well-off guy. He was in a suit and he was about half drunk. "What does it feel like to have a defective son?" He said that to me. Well, what was funny is there's this old construction worker over there. This guy was a giant of a man. He looked at him and said, "He don't know. Why don't you ask your mama?" I still laugh. That was so funny. But that old, he wasn't going to say anything, that old construction guy. But I have an autistic son, and you go in the store, and sometimes people don't, they're not used to dealing with disabled children. So he likes people. He goes in, he may tap somebody on the shoulder. We were tell him he wants a Coke. We were in a restaurant and I'm walking and he's going by me eating a chicken leg. I said, "Where'd you get that?" There's this old man was eating fried chicken. He was just rolling because Zoe walked by and picked a piece of chicken up off his plate. Those how so not everyone believes the same way we do about physical and mental issues. And sometimes families are ashamed, like there's something wrong with them because the child had a problem. No, but those are ethical issues. How do we treat those things? Vaccination, individual freedom versus public health. I wonder about the individual freedom versus public health. When I was in the United Arab Emirates and spent 10, 11 years there, and we had the COVID outbreak, I got the call, "You go to the tent." Listen, if I hadn't went to the tent and got the COVID shot, they'd have sent me out of the country. It wasn't voluntary. You're going to get the shot. My daughter, my son's girlfriend quit her job rather than take a COVID shot. Well, you got to, I just, Sharon, I don't even want to tell you why Sharon reacts to that. Sharon talks about, and she's always begging for money. Go to work, go get your COVID shot. End of life care, we touched on that, the quality of life and the dignity and refusal of life sustaining treatment. If I'm in a hospital and I have a stroke and I'm very bad, they can put me on life support mechanisms or I can refuse it. Look at the ethics of that. What if the rest of my life, I'm thinking the rest of my life I'm going to be a burden to my family? I'd rather go on home. But there's many ethical decisions there. Some of our cultural and religious influences, I want to touch some of those. Beliefs shape our ethical views on health. Some people's religion causes them not to do certain things with healthcare. I'm not going to have a blood transfusion because it's against my religion. Well, some people have, it talks about ethical practice vary across cultures. I'll tell you a story about one of my deacons. He was a horrendous racist. He hated anybody that looked any different than he did. And I invited a couple of my black friends to come to church to preach that Sunday to tell about the work they were doing. He left the church over it. He was so angry. How dare me have a black preacher stand in the pulpit? I grew up as a kid singing red, brown, yellow, black, and white, all are precious in his sight. Jesus loves the little children of the world. That's taught in the scripture. What is interesting is that about 2 weeks later, he had a heart attack. And he was very close to death, and the doctor that saved his life was a black doctor. Now, God has a sense of humor. His racism, people's racism can stop them from doing certain things and seeking the care that they need. Do you know that there are men that will not be treated by a female doctor? You ever seen men that disdain all women? I've seen that. I've dealt with that in disciplinary actions before.
You were just so weak, okay.
Yeah. Well, yeah, I can get your tooth out. Do you want painkiller? Yes or no? Show me you're tough. Let me pull it without painkiller. But those things and cultures are different. Um, some cultures, the Anglo culture is an abusive culture. I'm just going to tell you, the Anglo culture is not into saving face. Not, I mean, you need this shot, type thing. The Hispanic culture is very much about saving face. It's a very kind culture. And it's based on the Arabic culture because through Spain, the Arab culture influenced Spain and Spanish influenced Hispanic culture in the New World. So my mother's her middle name was Montez, Mary Montez. Montez in Arabic means excellent. I told her one day, I said, Mother, they were lying about you when they named you. They said you were excellent. Said I am excellent, and all that. But different cultures react differently. And different cultures have different expectations. Sometimes different genders different. Oh, those type things we have to know. So health professionals have to identify cultural competence, respect for diverse values, evidence based. You base what you treatment on research and what it shows us, and empathy and open communication. Have you ever been to a doctor that was rude? Oh yeah, I went. They carried me to a doctor at Ross Arcama Hospital. He was a cardiologist. Rudest man I ever met. And he was just downright rude. And I finally got him. I'll take so much and then I bite back. My wife told me, said, I can't believe you told him that. I said, and him standing there. I said, he ain't gonna be rude to me and me put up with it. Just because you're a cardiologist doesn't give you the right to treat people this way. And he said, then I went and got a cardiologist that was nice. I love the nurse practitioner that I see now. He comes in, I come in, he says, Rusty, how's it going? He said, what's your blood work going to show me? You been eating ice cream? Yes or no? Things like that. But he emphasizes. He's respectful. I have to, when I go to the doctor, Sharon's at work, I have to carry Zoe with me. I apologized to him. I said, I'm sorry that I have Zoe. He said, oh, Zoe man doesn't bother anybody. I said, unless you try to give him a shot, and then you like to see what happens. But as healthcare providers, we have to respect differences in people. They don't have to be just like us. They may be different than us. One of the things that I find at times that is harsh in some of the Anglo culture is it's very prejudiced, and those prejudices are gradually going away. We hope because our kids we've grown up together. But different cultures are entitled to see things differently. And if you if you I laugh about the Palestinian culture because Muhammad, my dear friend, is Palestinian. He's kind of like my adopted son. That he believes that mother is the gateway to heaven. You better be good to mama. Daddy, you can get away with anything. But mama is worthy of respect. He calls Sharon Mama Sharon, and when he'll come kiss her on the forehead, it's a sign of respect. You know, some cultures have more respect than others. Some cultures decide things differently. The family may have more say or less say. There may be belief systems that come in. We have to treat, as healthcare givers, we have to treat all people respectfully. I don't care whether they're like us or not. Some people live lifestyles that I don't believe in as a Christian. Still people. They're still people. Have you ever thought about when Jesus taught and what they accuse him of? He goes with sinners. The people that Jesus was seen with, that he was talking to, the righteous didn't want anything to do with those people, but the Lord still loved them. So empathy and open communication and respect for diverse values. I told a man one time, we were talking, I said, well, I respect your values, but you need to consider the impact of what you're deciding on your family. And I kind of drove it home about that. Another point, we're almost through, is informed decision making. Um, Ethical health choices require access to information. We've said that. Understanding the consequences. Uh, Friend of mine has just had he had a went in he had a blockage in the widowmaker artery, the big artery. I have 3 stents in mine. He called me and said, Rusty, said they found a blockage and I'm worried about it. Can you talk to me? I said, well, are you getting around? He said, yeah. I said, well, you're blessed because your body is compensating. He said, well, he said, now that they've told me, I begin to recognize a few little things. They went in and tried to do it, and they hit what's almost a rock. It's solidified. Wouldn't work. They told him, said, we have an 80% chance of this working. Well, he was in the 20%, it didn't work. They told him, said, in 3 months, we'll try it again. Didn't work. Now they're telling him we're going to have to do a bypass because the stent is the least invasive, but if it's blocked so completely that they can't get through, they're going to have to do a bypass. And but he knows. He went in knowing. They told him what the odds were. They told him the second time. A second time they told him, said, we have maybe a 50-50 chance of this working. We're going to try a new technique. It didn't work. He was just there, understanding the consequences. If I have this, here's what's likely to happen. If I don't have it, here's what's going to happen. Some procedures that they might suggest, you're just almost as well off not to have it. I hate to say that. Some of them you're not, some of them you're better. What is the impact of my decision on others? We talked about that. What is my personal responsibility to those around me? My wife depends on me. And I'm very much aware that in our current society, most of the time the man dies before the woman because women are tougher than us guys. Women live longer. The average age of women in the United States in the 80s, the average age of men is 78. So 84 versus 78. So the likelihood is the woman's going to live 6 years longer. The likelihood doesn't mean necessarily. And my wife is 3 years younger. She's going to have to live 9 years without me. That's why my wife, I insisted she have an education where she can support herself, take care of herself. But she tells me it's not going to matter because she's going to be riding with me, and the way I drive, we're going to go together. I have a wreck and kill us both. But personal responsibility and respect for fairness and rights. Ethics provide a framework to navigate complex health decisions. Um, I know a family that the daughter got pregnant, was unmarried. They chose not to have an abortion because they didn't believe in that, and they gave the child up for adoption. I know another family where mom and daddy raised the baby and helped the daughter. Um, those are things we have to decide, but we promote respect and balance individual and societal needs. That comes back to the vaccination issues. Not having kids vaccinated is very dangerous, not just for them, but for society as a whole. Look at what's going on in North and South Carolina with measles outbreak. Listen, I had chicken pox on top of my head when I had it. I didn't have measles because they gave me the measles shot. But measles damages a child's heart. Measles can kill. And if five kids parents decide not to have vaccine, and they expose two more kids who had vaccine, they not only jeopardize themselves, they jeopardize society. And there's a balance there somewhere. Responsibility and individual and societal needs. Key terms: autonomy, self-decision, beneficence, the ability to benefit from it, now non-malfeasance, not to cause harm. Justice means fairness. People are treated the same. Cultural competence. Cultures are different. We don't mistreat people because their culture is different than us. We don't mistreat people because their religion is different than ours. I have a good friend, Sharon does, that's a Hindi. I'm not a Hindi. I'm a Christian. I'm a Baptist. But she's a very sweet person. When she was our neighbor in the United Arab Emirates, one day she came over, she talked to her, said, "You don't have any bananas." Just kidding me. So I went out, I bought a whole box of bananas and brought them back while she was there. I said, "Here, Josie, take these home." I laughed. She couldn't eat that many bananas. But informed consent means that we have the information we need to make the decision. Now, what I'm fixing to do now, guys, is end the recording and then dismiss us.